Morning guys, just en route to London for one of our PLAB 2 Communication Skills Day courses today. Thought I'd do a really quick video on palliative care scenarios and how to not feel overwhelmed by the 100 or so things that you can potentially look into in a situation like this. It's really important to split it into three key categories: physical palliative care, mental health or spiritual palliative care, and practical palliative care. Now, if you think about physical palliative care, you're thinking about physical things that you can help a patient with, whether it be pain or breathing problems or coughing or secretions or constipation, or physical things that you may be able to treat or help from a physical point of view. You can talk about things like syringe drivers, you can talk about things like patient-controlled analgesia pumps. There's something physical you can do to help a symptom. Then you may have your mental health or spiritual palliative care cases, things like anxiety, depression in palliative care, things like fear of dying, fear of afterlife, guilt, leaving children behind, where you can maybe get religious people in. How can you help sort out this side of palliative care, because it's a huge component of those situations. And then thirdly, you have your more practical palliative care scenarios, things like DS1500s, things like wills, things like power of attorneys, things like Macmillan teams or out of hours or carers, and thinking about support systems. So the more practical side of things that you can think about and help a patient with. Now, if you try and cover all of these things in 10 minutes, for example, it's just too much, it's too overwhelming, and you leave the scenario thinking quite underwhelmed because you think, I could have done so much more. But if you kind of start broad, think about these three areas, delve into them a little bit, pick up what you think is the main one or the main area, and then go all in and focus on this in detail, then you're going to walk out thinking, I've dealt with the real issues of that situation much better than trying to skim it and just cover everything and mention everything that I can potentially think about in a palliative care situation. So think about these three things: physical palliative care, mental health or spiritual palliative care, and practical palliative care, and you may be able to control your cases a little bit better. Hope this helps. #CanPass will pass. See some of you guys soon.